Heart disease. It's a term we hear all the time, right? But what does it actually mean? Honestly, it can feel like this massive, intimidating subject. So today, we're going to break it all down into clear, understandable parts, and we'll start with a really simple but super important question. So let's just chew on this for a second. Because here's the thing, the single most important concept to get your head around is that heart disease isn't one specific diagnosis you get. The key to really grasping the whole topic is realizing it's something else entirely. And there it is, the big answer. Heart disease is actually an umbrella term. Think of it like the word weather. Weather isn't just one thing, right? It can be sunny, rainy, snowy, windy. Well, in the exact same way, heart disease covers a whole range of different conditions that affect your heart and your blood vessels. Understanding this one idea, it changes everything. Okay, so let's pop open that umbrella and see what's actually underneath. We're going to look at a few of the most common conditions that fall into this category, just so you can see how different they can really be from one another. First up is the one you've probably heard of the most: coronary artery disease, or CAD for short. This is by far the most common type. At its core, it's basically a plumbing problem. Plaque, this sticky stuff, builds up inside your arteries, and that narrows the passageway for your blood to flow through, kind of like a clog in a pipe. Next, we have a totally different kind of issue, arrhythmia. So if CAD is a plumbing problem, think of this one as an electrical problem. An arrhythmia just means your heart's rhythm is out of whack. It might be beating way too fast or too slow or just kind of all over the place. It's a glitch in the heart's own internal pacemaker. And finally, let's clear up a huge misconception about a term that sounds absolutely terrifying: heart failure. Okay, this does not mean your heart has stopped working completely. Not at all. Instead, heart failure means the heart muscle has gotten weaker and it can't pump blood as efficiently as your body needs it to. So think of it as a problem of power, not a full stop. Okay, so we know heart disease is a collection of different things, but how would you even know if you had one? Let's switch gears and talk about the signs your body might be giving you, and also the factors that can increase your risk. Now, the symptoms can be a little tricky because they're not always dramatic like you see in the movies. Of course, chest pain, that's called angina, is a classic sign. But it can also show up as something much more subtle, like indigestion, nausea, or maybe an ache in your jaw or your back. And these signs can be really different depending on the specific condition, so it's absolutely crucial to listen to what your body is telling you. Now, this is a really important distinction to make: the difference between a direct cause and a risk factor. The big three causes, we're talking high blood pressure, high cholesterol, and smoking, are things that directly damage your arteries. Risk factors, on the other hand, things like your diet or stress levels, are what create the conditions that make that damage more likely to happen. So if you're experiencing symptoms or you have some risk factors, what happens next? I know the path to a diagnosis can seem pretty daunting, but it's actually a very logical step-by-step process. So let's walk through that journey together. It all begins with a conversation. Seriously, the first and most important step is just talking to your doctor about what you're feeling and your medical history. From there, that'll lead to a physical exam, and then your doctor will figure out which tests, if any, are needed to get a really clear picture of what's going on. And doctors have a lot of tools in their toolbox to figure this stuff out. They can run blood tests to check on things like cholesterol. An EKG can analyze your heart's electrical signals to spot any arrhythmias. An echocardiogram is basically like an ultrasound for your heart, showing how well it's pumping. Each test just provides another piece of the puzzle. All right, now for what I think is the most empowering part of this whole explainer. Understanding a problem is step one, but taking action is what really truly matters. So let's look at how heart disease is treated and, even more importantly, how you can work to prevent it. I love this because it just drives home the point that you are not alone in this. Treatment isn't some one-size-fits-all prescription they just hand you. No, it's a personalized plan that you develop with a team of professionals who are there to guide you based on your specific condition and your needs. Generally, treatment rests on three main pillars. First, you've got lifestyle changes. That's the foundation. Second, there are medications like statins to manage things like cholesterol. And third, if it's needed, you have surgical procedures like an angioplasty to physically open up a blocked artery. A lot of the time, a good treatment plan will involve a combination of these. And look, while those treatments are incredibly advanced, the real power, the real game changer, lies in prevention. Why? Because so many of the key risk factors aren't just bad luck or genetics, they're things we can directly influence with our daily choices. You genuinely have more control than you might think. Let's focus on one specific, really powerful number: 150. Health experts recommend getting 150 minutes of moderate exercise every single week. Now, that might sound like a lot, but if you break it down, it's just a little over 20 minutes a day. A brisk walk at lunch, a bike right after work, that is such an achievable goal, and it has a massive payoff for your heart. So, what are the heavy hitters of prevention? Well, avoiding smoking is number one, period. But beyond that, it's about focusing on whole foods, watching your salt intake, staying on top of your key numbers like blood pressure, and managing your stress. These aren't about some drastic overhaul of your life. They're just sustainable adjustments that protect your heart for the long haul. So, we've unpacked the whole umbrella of heart disease. We've looked at the signs, and we've explored how to take control. It all comes down to this one last question for you. Don't think about next year or even next month. What is one small, simple thing you can do for your heart starting today? Because that's where real, lasting change always begins.